Okay, good afternoon, everyone, and thank you for being here. I certainly want to wish everybody a happy Lunar New Year to everyone celebrating today. Had several friends text me this morning on wishing me a happy Lunar New Year, so we right back at everybody out there that's celebrating that New Year celebration. So I'm joined here by a whole government COVID response team. I thought it was important, as this is the first press event that we've had since the transition is now in full swing, and I want people to know that it's in progress and that we've got very capable people in the state of Rhode Island that are leading the charge in terms of the transition at the Department of Health. Thank you for Lieutenant Governor Matos for being here, Interim Department Director of Health, Director Dr. Jim McDonald, Mark Pappas, Senior Advisor on COVID, General Callahan, Commerce Secretary Stephen Pryor, and Department of Health Transition Team we announced last week with Anna Novas, as along with Assistant Secretary of Health and Human Services, Ernie Almonte, Chief of Staff for the Lieutenant Governor, and Chris Aberline, who is Deputy Chief of Staff in the Governor's Office. Earlier today, I visited the Department of Health and got your feet on the ground and went from department to department with the direction of Dr. McDonald, met people in the finance, met people who are working on issues that have to do with infants and moms, recent moms, and other areas that in technology, and saw firsthand and spoke to everyone that we could meet, and we'll come back again to finish it up. It's a large department that does a great deal of important work, and I want to thank them for the work not only during COVID, but also prior to COVID, and the work that continues to go on in the Department of Health that is related to COVID and actually not related to COVID. So in just a bit, before I turn it over to Dr. McDonald, I'm going to ask Anna and Ernie and Chris to just come up to the mic and briefly share their background and what they will be doing at the Department of Health as we inform the people in the state of Rhode Island about the transition that's going on right now. I want to begin by talking about what Rhode Island is currently seeing in terms of data trends. It is important to note, we know that our testing and case numbers from this weekend were impacted by the storm, as I said, tongue-in-cheek, the TB12 2022 blizzard, but it's very clear that we have seen a dramatic decrease this month, and week over week our numbers are moving in the right direction. If we look only at our pre-snow storm numbers, cases are down roughly 75% since Rhode Island experienced its spike in cases in early January, and that's good news for us. I want to thank Rhode Islanders for stepping up and doing the right thing, getting vaccinated, getting boosted, and following our mask and vaccine protocols. We are starting to see the light at the end of the tunnel when it comes to this winter surge, so let's keep it going. Our 7-day case average is declining, just as it was last week. It's down 47% from a week ago. Our 7-day average for percent positive is also down from 18.5% last week to 15.6% this week. Yesterday we were at about 12.5%. Our hospitalizations have also dropped below 400 for the last 7 days. The data is continuing to show that Rhode Island is moving in the right direction. On FEMA and Ring hospital staffing, I have an update on our administration's plan to address the staffing crisis that continues to impact our local hospitals and their systems. I'm announcing today that we're expanding our use of the National Guard to support several hospitals across the state, in addition to the Butler Hospital mission. Our total of 30 National Guard members are being sent to the following hospitals: Eleanor Slater Hospital, Fatima, Kent, Landmark, Miriam, Newport, Rhode Island Hospital, Roger Williams Medical Center, South County Hospital, and Women's and Infants. I can't thank the General Callahan enough for him and his National Guard members for that work and stepping up again and again and again to do what we need to keep the people safe in the state of Rhode Island. This morning I visited Rhode Island Hospital to meet and thank the federal medical military personnel that we secured through FEMA. From what we've seen, the partnership is working well, and hospitals are grateful for the relief, and leadership at the hospital, which I spoke to, felt as though that this is making a significant impact in a positive way. And so we thank FEMA and all those individuals that came from states around the country. When I was talking to the individuals that came here to help Rhode Island, you had people from Hawaii, Minnesota, Texas. You had people from New Jersey, all around the country that are serving this country. And actually, they promoted a major today, right, General? A major was promoted, and they zoomed their family in from Texas so that they could participate in that, moving someone to a major. And that was a great swearing in that we were able to attend. So we're currently in process of requesting a 30-day extension for the federal medical personnel team at the Rhode Island Hospital. The Kent Hospital team, which was on a 2-week assignment, has been approved for a 2-week extension, and we are preparing to ask for another extension on top of that. So we thank FEMA and the administrator, who I did talk to last week during the storm, and thanked her for advancing personnel to the state of Rhode Island in a way that's helping us significantly deal with the staffing issues at our hospitals. We're also taking another step to address staffing levels. I signed an executive order that eases requirements and allows nurse graduates to practice sooner under the supervision of licensed RNs while their regular license applications are processed. Our team is currently continuing to work on this issue and identify new ways to provide relief. Nothing is going to provide relief to our hospitals than a reduction of hospitalizations. So that's why we're encouraging people to get boosted, continue to work on that, and to protect themselves in a way that keeps their families safe. And again, nothing is going to provide more relief in the hospitals than keeping people out of the hospital. Before I turn it over, I want to remind our small businesses out there that we have a new Rhode Island Rebound Small Business Grant Program. Opens today at 3:30. Thank you, Secretary Pryor, and your staff for being so quick to get this on the ground. Applications will be accepted through February 15th, 2022. Through this program, we're making $12.5 million in direct relief grants available to small businesses that continue to struggle financially due to the COVID-19 pandemic. I want to thank our leaders in the General Assembly, Speaker Sakachi, along with President Ruggiero, for passing our proposal earlier this month to allow a much-needed investment in our state's small businesses early in the new year. Part of those dollars has to do with housing as well as child care, and we'll be updating the people of Rhode Island on how those dollars will be distributed very soon. In one of my first acts as governor, we set up a Rhode Island Relief Grant Program, which deployed checks and assisted about 3,600 small businesses. We know small businesses are struggling, and this is an additional strategy for businesses to get some help. Commerce Secretary Pryor and his team have been working to keep this as simple as possible. The federal government has certain requirements, and there is no wiggle room on some of it. But for our part, the state has tried to make this as simple and straightforward and as efficient as possible, and we stand prepared to help small businesses to work through the applications. This is a part of our plan to help small businesses. There are additional Rhode Island Rebound components that will be rolled out in the coming weeks and months, including technical assistance, funds for outdoor activities, improving ventilation, and additional for our hard-working, hard-hit tourism, hospitality, and event industries. Secretary Pryor is here today, and should there be any questions about this grant program, he stands ready to answer that.